Hi, I'm Christina Herrin, Government Relations Manager of Health Policy at the Heartland Institute, and today I'm interviewing Dr. Colin Banas to discuss telehealth expansion and the benefits of utilizing technology, especially in the fight against COVID-19. So thanks so much for taking time to talk with me today.
Well, thanks for having me.
Yeah, I'm excited to talk with you. Can you just give our audience a brief background on what you do and how telehealth allows for patient-centered care and creating affordable and accessible care for patients?
Wow, that's a whole mouthful. Yeah, so I am an internal medicine physician, hospitalist. Previously, I was the chief medical information officer for a large academic health system, but about 2 years ago, I joined Dr. First and am now their chief medical officer. And Dr. First is an innovative healthcare IT company with a lot of irons in the fire, if you will. And specific to telehealth, which was the second part of your question, I would say that the term patient-centered is really the most important thing that we've come up with in this last year of the COVID crisis. And what I mean by that is you'll hear a lot of catchphrases. Healthcare IT and specifically telehealth has exploded 10 years in just 10 weeks early on in the pandemic. And what we've really found is that it's a new paradigm for taking care of patients. Telehealth is a lot of times a better and more efficient way of caring for our patients. So I think, the third part of the question related to the benefits. And I think early on, the benefits were almost out of survival for clinics and for hospitals. There really was no other way to see our patients, to take care of our patients. Right. And early on, when protective equipment, PPE, was in short supply, it also had the added benefit of being able to preserve that. So if a patient could stay home, or a nurse or a doctor could avoid going back into the room yet one more time by using some of these technologies, then we were able to preserve that equipment. I think you fast forward past when the equipment stopped being quite a crisis, and you started to realize that patients liked it. A large majority of patients have participated in some form of telehealth in this past year. Literally, the adoption is in the thousands of percent growth. A lot of health systems went from not having any program in place at all to seeing thousands of patients within a week. So I think it straddles that line of being able to keep the doors open because now we can see our patients, take care of our patients, provide the care we need.
Right.
And we've also discovered that it's actually, like I said, a better way to care for our patients, and they actually like it in a lot of situations.
Right. So patients are preferring this type of care. And then also with COVID-19, I know that we've seen patients that are avoiding routine care and preventative care, and expanding telehealth, could permanently help patients. So what are your thoughts on that, on expanding this and beyond COVID-19? I mean, what is your company looking at?
Yeah, so Dr. First is looking to bridge the gaps in healthcare IT. In other words, to break down these silos that have existed for so long through the use of technology. And your comment about the avoidance of preventive care and routine care was spot on. We actually saw a precipitous drop in things like routine vaccination, screening exams like mammography and colonoscopy. We even saw emergency departments have less heart attacks show up. And obviously these heart attacks were still occurring. They just weren't going to the hospital to have them. And so when patients finally did seek care, they were often a lot worse off than they would have had they gone originally. So I think, at a minimum, expanding telehealth, which we've seen, glimmers of its permanence, expanding telehealth will again allow some of these care paradigms to continue. I will caution that there are some things that will never replace the in-person visit. So I don't think this is the end all be all, but I do think it's an entirely new way of caring for our patients. And it's actually really putting the patients back in control, or even more in control than they were before, because now we're meeting the patients where they are. We're meeting the patients where they want to be met.
Yeah, well, that's phenomenal. And I mean, I completely agree with you. And I'm here in Iowa. So I know for a lot of rural residents, telehealth is just huge and expanding. It could mean, tons of care for people that just aren't, getting their needs met. So I think that would be great. What are some barriers that your company, are dealing with to expand telehealth, or just in general? What barriers are there to telehealth access?
Yeah, I think there's a couple big buckets to think about when we talk barriers. I think one of the early barriers was probably technology. So as I mentioned before, some clinics, some hospitals did not have the technology in place and really had to go fast to get something up and running, and then had to revisit the decision to go get something a little bit more permanent, a little more enterprise grade, if you will. You heard the stories of people using FaceTime, for example. Well, obviously that's not sustainable. That's not safe. So at some point they had to transition into a more permanent solution. I think the second bucket relates to comfort. So I think, once the technology was in place, there was still a learning curve for the doctors, for the patients, to be able to, say, hey, okay, actually, this is a method of care that I'm comfortable with, that I will go ahead and participate in. The third one, back to technology, and this is where our Dr. First really shines, in my opinion, is we want to make, after you've cleared hurdles 1 and 2, we want to make the process so easy, so frictionless that you can't mess it up. And what I mean by that is we don't want the patient to have a complicated app, an additional download, a lengthy registration, anything like that. We want the friction. We want no friction. So basically, for our technology, for example, if you can receive a text or you can receive an email, you can participate. You can start chatting securely with your doctor. You can participate in a video visit, a video chat. You can even bring in family members or other caregivers. And so that's really one of the barriers that we helped knock down, was sort of that ease of use, or human-centered design and usability. I think the fourth big one, you mentioned rural. I think a big one relates to broadband access. And for a lot of communities, having high-speed internet just isn't a reality yet. And I do think there are things on the horizon. I think the government is putting programs into place to promote and get these areas built up. There's also even satellite technology that's coming probably within the next year or two, hopefully, where broadband can be provided literally from space. So I do think there's some exciting things that are on the horizon. And actually, to that point about rural communities, that's also why you saw some of the restrictions on how telehealth was delivered get eased, if you will. And so a lot of rural places were able to make do with telephone calls, which is not something you could do before COVID, but at least it was something, right? And so those are the sorts of things that were barriers that we're really looking as a community to knock down, to break down those barriers.
That was a phenomenal answer. And, I completely agree with what you said. And I want to kind of touch into what the future of telehealth looks like. So we've got 2021 on the horizon. Are there any, big goals or needs that are going to be met here in the coming year?
Yeah, at Dr. First, we like to talk about healthcare without walls. And it's actually a phrase you'll hear coined in other facets as well. And I think what you'll start to see, or actually what will accelerate in 2021, I should say, is more and more a push to keep patients at home, whether that's Internet of Things, connectivity like blood pressure cuffs, scales, et cetera, oxygen monitors, anything that we can do to care for the patient in the comfort of their home safely. I think you're going to see an uptick in that. And so, the idea of, always going somewhere to get your care, I think is slowly going to pull back in 2021. And I think that's really brought on by this consumerism. And I hate to use the word consumerism as it applies to patients, but it really is applicable in that patients are looking for that same experience that they're getting from other industries, the airline industry, restaurant industry, Amazon. They want it all there. They want it all tied together neatly. And it's back to my notion of meeting the patient where they are. So I think we're only going to see an uptick in those sorts of remote monitoring and Internet of Things connectivity in 2021.
Yeah, well, that's great. And I talked to a lot of people who are on the policy side of telehealth, but not as many, people actually in the industry. So I think it's really important that we're hearing from you. And do you have any final thoughts for our audience regarding telehealth or just medicine in general? There's a lot going on and a lot, to cover, but do you have any final thoughts?
Yeah, I think, the one bright spot, perhaps of the pandemic is this acceleration and a new way of caring for our patients.
Right.
I will say that I think we're about to enter an era of not only connectivity, as I described earlier, but also transparency. And what I mean by that is patients having more, transparent access to their data, payers and hospitals and clinics all providing the data, and it's all safely exchanged and available as needed. Things like knowing what a drug will cost a patient or knowing what kind of approval might be needed. All of those things are going to get easier. And that type of transparency helps build trust, so that the trust that patients have in their healthcare providers and in the entire healthcare ecosystem really boils down to transparency. The second thing, and I know it's a little long-winded, but the second thing I'm excited about is the notion of apps. So back to the transparency concept, the idea that patients are going to have access and ability of more and more apps to plug into their health system, to plug into their doctor, to plug into their pharmacy or their payer. And in fact, as you would know from the policy side, there's actually regulations that are kicking in a few months that require the healthcare ecosystem to open up and allow these apps and these connections to take place. That's really, really exciting.
Yeah, I think that's awesome. And that's a really good point. I mean, we're seeing it in lots of different industries, right? You can sell a car through an app or maybe buy a home through an app. And I think medicine moving in that direction where people have access at their fingertips is nothing but good. More information to people as quickly as possible, especially in regard to healthcare, is really important. So I think the work that y'all are doing is phenomenal, and I appreciate you taking time to talk with me today. What is the best way for our audience to stay up to date with the work you're doing, or if they're more interested, to keep learning, what's the best way for them to stay up to date?
Sure. So I visit the website, of course, drfirst.com. Wonderful information there. We also have tremendous social media presence on LinkedIn, Twitter, etc. And actually, I'm still a fan of email. So if anyone wants to email me, I will happily respond. It's cbanas@drfirst.com. I look forward to it.
Yeah, and we'll definitely link some of your social media below. And, I really appreciate you talking to me again.
Yeah, thank you.